Sego and good afternoon, Akwesasne. I'm Louis Jacobs and it's Friday, April 24th. We hope everyone had a good week and that you're keeping safe. Earlier this week I had a phone interview with Mike Cook, Director of the St. Regis Mohawk Tribe's Health Services Division. I wanted to get a take on how he thought society is handling everything during these pandemic times, especially in our community of Akwesasne in regard to healthcare. Mike spoke about when the pandemic first began and how their first priority was for the safety, of course, of the community and the staff there. Social distancing protocols, of course, were immediately put into effect with on-site services being limited for the time being. I think that's pretty clear. To this point, Mike said telemedicine might possibly be the new norm for the future of medicine, and we're already seeing that. Health Services has implemented this practice to a very large degree. I'm sure everyone has noticed. Obviously, a person doesn't just show up at the clinic. They have an initial discussion via phone with a nurse, and then they'll speak with a doctor if necessary to get diagnosed. Mike spoke about the chronic care patients at the clinic and the people who do need to come in. He also spoke about the importance of staff follow-up with the chronic care patients, and he emphasized that we're still here for these patients. So I guess the point is he didn't want anyone to feel sort of left out in the cold, and if you do need to come in, make a phone call to them and they'll get you taken care of. I asked Mike about the morale of the staff at the clinic, just to sort of check in on that aspect, because these are human beings going to work in the medical field during a pandemic. And Mike said that he feels that actually the staff is doing okay. He's very proud of the way everyone stepped up. They were very quick to put a plan into place, and that he feels that everyone is very focused on their work. He also added that it's important to pay attention to scheduling needs, as of course there's a bit of anxiety being a frontline worker, so it's important to consider things like time off and self-care for the staff. Finally, Mike and I talked about behavioral health, and he wanted to emphasize that behavioral health, the staff is still very much available. Obviously, people are anxious with the state of things in the world right now, so the staff is there to help. And he spoke specifically for a moment about our youth, the young people here in our community, and how sometimes it's just very difficult for them, everybody, but young people especially, difficult to comprehend this huge societal change and what's happening in the world right now. So there are people there in the office ready to discuss via phone or a phone chat, a video chat. And to that point, I will give the phone number for the behavioral health line there at the clinic, and that's 518-358-3145. If somebody needs help or has some questions, 358-3145. And of course, the main line at the clinic is 358-3141. And that's the main line for the clinic. So we do owe a debt of gratitude and respect to the people on the front lines at the clinic, especially with the added margin of uncertainty and risk during these times. So a very special thanks to Mike Cook for speaking with me earlier this week, and to all of the staff at the clinic. A huge nawagoa for your service. Okay? Thank you. And that's it for me today. Wishing you all a great weekend. Stay safe, stay healthy, stay strong. For Akwesasne TV, I'm Louis Jacobs. Yo honey, yo honey, yo honey.